In your view, what are the core issues China's healthcare reform is primarily aiming to address? And do you consider these goals to be clear and well defined?
China reforms is highly people-centered, and the goals are very clear. They focus on fixing two main challenges: high medical cost and poor access to quality healthcare. For the cost issue, they use centralized bulk procurement for medical supplies, which has dramatically cut prices sometimes by over 95% for things like cardiac stents. They also introduced the direct settlement scheme, so patients don't need to pay huge amounts upfront and wait months for reimbursement. For access, they aim to redistribute resources to underserved regions. They use technology like telemedicine and 5G smart clinics to connect top urban doctors with rural areas. This ensures that high-quality services are available everywhere. By addressing the specific issues, the reform is building a more equitable and efficient healthcare system for all Chinese citizens.
Thank you for that clear overview of China's reform goals. Our episode mentions that China has implemented the Healthy China initiative as a key national policy. I'm curious, in your country, are there any policies or programs for healthcare services?
Yes, France has a strong national strategy similar to the Healthy China initiative. So our main policy is often guided by major national laws like the Stratégie Ma Santé 2022. The goal is to make healthcare more equal and efficient across the whole country. We are addressing the problem of medical desert, where rural residents struggle to access timely medical care by redistributing medical resources and deploying modern equipment to underserved areas. We are also having a key national program for prevention. This includes free vaccination for everyone and organized program for consent screening, like breast cancer. Like China, our final aim is to make sure every citizen has access to quality healthcare.
Okay. It's insightful to learn about France's strategy and the focus on prevention. A key part of any national strategy is ensuring its benefits reach everyone fairly. China has made great efforts to make a more equitable, efficient healthcare environment for all. In France, are there any measures taken to promote equal access to healthcare services?
Yes, promoting equal access is a core value in France. The main measure is our national security system, which ensures the cost is generally not a barrier. Additionally, the government offers significant financial aid, like the Complémentaire Santé Solidaire, for low-income citizens to guarantee full coverage. Moreover, we use incentives to address medical desert. For instance, urban hospitals earn incentive for training rural counterparts, while rural clinics receive funding boost from keeping preventable cases out of overcrowded cities. These measures are very effective in attracting professionals to rural areas. On a structural level, we promote community health centers that bring different medical professionals together. Finally, we have international measures such as the European Health Insurance Card, EHIC. This allows French people to get medical care in other European countries without paying upfront, which parallels China's new cross-regional direct settlement system.
Those are compelling examples from financial aid to structural measures. Now, shifting our focus from the system's design to the individual's experience, how do you think healthcare reforms that prioritize patient convenience actually shape a person's overall healthcare journey?
Reforms that focuses on patients' convenience have a huge positive impact on the overall healthcare experience. They remove a major reason why people might choose not to seek medical care. First, when costs are settled, instantly there's no paperwork, the patient feels much less financial stress, which brings peace of mind. Crucially, removing cost and administrative burdens means people are not discouraged from seeking treatments due to fear of bill or complexity. Secondly, it provides practical benefits. Measures like the mutual recognition lab test or telemedicine saves a lot of time and money, especially for people who must travel to visit different hospitals. It makes the system more efficient. Finally, convenience promotes equity. When the system is simple, it helps vulnerable people, seniors, or people with low income to access and navigate the system easily. Simple services are fairer services, leading to a better public health overall.
You've perfectly highlighted the psychological and practical benefits for patients. It seems that technology is the common thread enabling many of these conveniences. In your view, what role does technology play in promoting healthcare reforms?
I believe that technology is the most important engine for healthcare reforms today. Its main role is to solve the major problem we faced: inefficiency and unequal access in poor coordination. First, technology helps centralize medicine information. In France, for example, our system is called Mon Espace Santé. It ensures that all hospitals and pharmacies have access to my complete medical records. This is a key for quality care because it avoids errors and unnecessary tests, similar to the goal of mutual recognition of testing results in China. Secondly, technology greatly improves accessibility and convenience by breaking down geographical barriers. We use simple video calls and teleconsultation cabins for fast diagnoses. For example, this summer I was in the Amazon, hours away from any doctors, but I was able to contact a French doctor online for a quick diagnosis. This shows how technology connects doctors and patients everywhere, similar to the 5G smart clinic in Xinjiang. Finally, it makes the system more efficient by automating administrative tasks like the direct billing system in China. It frees both doctors and patients from paperwork, allowing them to focus on health.
Thank you for this enlightening conversation.